हाँ जी, मेरा नाम डॉक्टर उमेश वाधवानी है और आप देखने वाले हो मेरा interaction with Charvi Jain. Let me tell you briefly about Charvi. Charvi is a counseling psychologist and a psychotherapist. She runs this really cool place in Kolkata, which is called Over a Cup Tea. It's a therapy center. Currently, they are taking online sessions as well. We spoke about mental health 101. So, all the basic things that you need to know about what goes into a therapy session, what are different types of therapies, what is the difference between psychologists, psychotherapists, and psychiatrists, where do we need medicines, can we get addicted to medications, all the shame around medications, the boundaries, and so many other things. So, if you are someone who is interested in mental health and mental well-being, do check this interaction out, and if you like it, give this video a like. If you haven't subscribed to my channel, please do so, and do check Charvi's work on Instagram at therapy.india, and you can check her work on her website too. Enjoy the video, and I'll see you in my next workshop. Guys, are we all excited? Like, can we show some excitement to Charvi at least, so that she feels कि हम ऐसे ही जबरदस्ती मैंने आपको बंदूक नहीं रख के रखवाया हुआ यहाँ पे. It is genuinely we are here to ask questions. Okay. Hi Disha.
Yes.
Hi Aditya.
Yes, we are very much excited. In fact, the past few workshops, we slightly had some idea, what's going to be covered. And the early ones used to have the title in detail, so we used to know what is there going to be. But now this one is just a phrase. And in fact, I very recently got to identify the difference between a psychiatrist and a psychologist. I had to Google it. I was crossing the road and there was a husband-wife couple whose board was there. So I thought they must be in the same college or not. One of them is a psychiatrist, other is psychologist. So what's the difference? So I got to know about that.
Okay.
So for general, mental stress and mental health issues, which is the first stream to reach out to? That is one area which I'm still not clear about.
Awesome. इस सवालों का सिलसिला already शुरू हो चुका है. I love it.
Yeah, I think that's a wonderful question, and I'm glad that you gave your personal disclosure that you did not know the difference between a psychiatrist and a psychologist. And believe me, you're not the only one. I think every person that I come across, they have the same confusion. And unfortunately, something as basic as this is something that is not that awareness is not there in our country. Which should be there ideally, because if we don't know what the difference, how do we know who to go to and when to go to, etc. And I think that's precisely the confusion and the question is arising from, right? So when it comes to mental health professionals, I'm going to confuse you a little bit more, because there's not just a psychologist, a psychiatrist. Well, within psychologist also there is a clinical psychologist, there's a counseling psychologist, and you might find a gamut of so many other. There's a psychotherapist. There are a lot of terms, counselor, counseling psychologist, a lot of terms here, right? So I think to put it in this way, when it comes to medication, when it's almost like the approaches are different. So we are dealing with the same kind of population, we are dealing with the same kind of ailments or issues, but it's just that our approach is different. So a medical professional who is a psychiatrist, he or she would have a medical degree, would be licensed, and which is why the approach through which she is going to, or he or she is going to go about, is by prescribing you medication, right? And when it comes to other medical professionals, if it's clinical psychologists, they will use psychometric tests to sort of figure out what you're going through, and through tests they will come to a possible solution. And when it's a counseling psychologist or a psychotherapist, they use psychotherapy, which is talk therapy, to help you deal with what you're going through. So
the one that goes on the lounge and couch and you. So the Shah Rukh Khan Dear Zindagi.
Dear Zindagi is therapist.
Yeah, something like that.
Wow. I don't know if it is something that we should be proud of or not, but we learn about therapy from our Bollywood films. It is interesting. So, but thank you, Smart, for kickstarting this questionnaire actually. But a further question, Charvi, if I may ask, So I believe psychotherapy has further different legs as well, right? It's not only talking. There are other therapies as well within psychotherapy, right?
Yeah, absolutely. I mean, I wouldn't call it types of psychotherapy. It's more like approaches
Okay.
of psychotherapy.
Mm-hmm.
So, it depends which approach you're taking. Like, for example, cognitive behavior therapy is something which is very, very, it's become very popular nowadays. Everybody knows about, CBT. So that they focus on, if I'm, going from the lens of CBT, then I would probably focus on the thoughts, cognitions of a person, and then move around what you're going through from that direction. And if I'm looking at from a psychodynamic lens, which is another psychotherapy, then I would probably go deeper and go into your childhood, what you went through, your subconscious beliefs and thoughts, and then from there I'm going to sort of figure out how to deal with the current situation. So similarly, there are different lenses, different approaches, and a lot of therapists are specialized in some. They prefer some. So everybody has their own preference, their own approaches. A lot of the times, we like to have like an eclectic approach. So depending upon how our clients are, what they are dealing with, we figure out which elements of which psychotherapy we want to use, and so that it becomes like a best fit, like customized thing for you.
Okay. Interesting. So there are different approaches and there are different modalities, and it would be up to the therapist to decide which modality to go to, depending upon what a client's need is. Hmm. Okay, I think हम वापस से आएंगे यहाँ पे because we started with a bit complex topic. Let's go back to the basics. I really want to know, and I'm not sure if others want to as well. I want to know when do we decide that we need mental health help? Like when do we decide? क्योंकि physical condition में तो पता होता है, बुखार आया, क्रोसिन खाया, नहीं मिटा, 3 दिन के बाद डॉक्टर को दिखाने जाना है. How do we decide whether I need a mental health help or not?
Yeah, I think that's exactly is the problem. We are looking at mental health from the lens of mental illness. So, of course, when there is like, like the example that you gave also, ki jab bukhar aata hai, then we should go and seek a doctor. But that's a physical illness, right? Physical health, though, we have to take care of it on a day-to-day basis. So it's almost as basic as asking a question that when should we work out? Like when is a time when we should decide that we'll start working out? Well, there is no answer to that, because ideally we should do it every single day. So similarly for mental health also, there is no specific red flags that should come and then you decide to work on your mental health. It should ideally be a part of your daily routine. But of course, when it comes to mental illness, then of course going to a psychiatrist, yes, there are certain red flags that we can look into. That should be like a compulsion that now we have to go and seek professional help. And those red flags would mean would I think all of you are aware of. Those red flags would obviously mean if you're too emotionally overwhelmed from day-to-day basis, maybe you are going through a lot of crying spells, maybe you're finding it very hard to manage your time, maybe you are withdrawing socially and you don't want to deal with people too much, or your functionality. I think that is a very big red flag. When your functionality starts to get affected, you're not able to do the work that you want to do or as well as you wanted to do. I think those are important red flags to look out for when you must seek professional help. But in terms of if you really want to take care of yourself and you want to be healthy in general, then I would say every day. Like I think today is the day when you can start taking care of your mental health.
Okay. Now this is something which I just learned. I'm not sure about others. I just learned now. So taking care of mental health is like looking after your nutrition and looking after your physique by working out. It's a daily thing. So you don't have to wait for something to go wrong. Would you say it's more of a preventive measure?
Yeah, absolutely. In fact, why wait for something to go wrong and then work upon it? Just like why should we wait for our cholesterol levels to go up, or maybe our arteries to get blocked to start having a better diet plan or whatever, right? We might as well start from today. We might as well start eating healthy now if we want to prevent all of that from happening.
Okay. I have a sub question, but I think Renita was raising her hand. Renita, did you want to ask something?
Yeah, but so like you mentioned about yourself. So how do you get someone else to go to a psychologist? Like you've been observing. See, most of the time, once you're in it, you are in denial that you will not accept it for yourself, right? So, but I am a friend and I've been noticing that, okay, this person has been having certain issues. So now, how do I convince that person, especially if that person is someone who is older to me or higher in authority as compared to me? So, like explaining it to someone who's younger is easier. They'll still listen to you out of respect. But someone who's older to you or higher in authority, how do you get it to them and how do you get them to actually get help?
Yeah, well, I think that's a brilliant question, Renita. And I think in some ways it's a very systemic issue that we have. The way we look at therapy or the way we look at any form of mental health help is there's a lot of stigma attached to it, right? And even when we ask someone out of concern and out of our best interest, when we ask someone to go see a therapist, sometimes it can be taken as an offense. They can get offended, and that's the irony of it all, because if you were to ask somebody that, okay, come, let's go to a doctor to help you out with this physical problem that you're going through, it will be taken as okay, wow, you're so caring about
Right.
it. But unfortunately that's not the case when it comes to mental health, and that's something that we're trying very hard to change, and I'm hoping that we can change it in the coming years. But I think, honestly speaking, I think the only way to go about it is, firstly, not putting it across in the way that, okay, you have there is something wrong with you and hence you have to go seek help, but more like, you probably need more support, and it's something that I cannot help you with because, well, I'm not qualified, and maybe somebody with a little more qualification, somebody who's trained to deal with this, will be able to help you deal with what you're going through and give you a direction in some way. So I think that the approach can make a difference. Sometimes it can, sometimes it doesn't, but I think that's the only way to go about it. And honestly, just leaving it on the table and helping them maybe research a therapist. I think that's the only thing you can do. There is not much you can do, because forcing them to go see a therapist will also sort of defeat the whole purpose. So I think just putting it in their mind, in their thought, and then hoping that they will act upon it. I think that's what we have to trust.
That's such a nice answer, yeah.
Thank
Like,
you.
thank you, Chavi. Okay, I want to ask, how do you reduce digital addiction to mobile screen? Post lockdown with work from home, my usage of phone has gone uh, extensively up and is affecting my productivity. Is it a mental health issue?
Wow. Yeah, I think the keyword is that it's affecting my functioning, it's affecting my productivity, right?
Hmm.
So I think that is a red flag for everything. If there is anything in your life, whether it's addiction or it's mobile phones or anything, actually, if it's affecting your productivity, affecting your day to day functioning, then it's definitely something that is a problem to fix, a problem to deal with. So yeah, when it comes to mobile phone addiction, I think how I would go about it is to figure out what is it providing you. Is it providing you, because a lot of times we delve into something because there is a void that it's filling. So it could be that it's giving you that dopamine rush that you require in the day, and you're probably not getting it otherwise. By dopamine rush, I mean that kick that you get, maybe out of being posting a picture or just scrolling through, it becomes a habit, scrolling through the profile, etc. So automatically, physiologically also, we start requiring that, on an everyday basis. So to break that cycle, we'll probably have to look out for other ways that can help fill that void for that moment. So maybe if you're doing it because you don't have, it becomes it's like a pastime, then finding a healthier pastime for that moment, or something which is equally pleasurable, because obviously if you're taking something away, it needs to be filled with something that sort of is the next best substitute. So, and then slowly, I mean, once you've moved through a healthy substitute, and then maybe you can look at, since it's already a healthy substitute, then you might not have to change that. But that dopamine rush that you're getting, that is something which is not good to sort of be addicted to. So I think gradually desensitizing yourself to it, reducing the hours, maybe, if it's like half an hour every day, then moving it to 20 minutes and then 15 minutes, just a hypothetical example.
I know. Then there are different ways as well, like dopamine and then serotonin, and so there are different highs. And I think it will take a completely separate session for mobile phone addiction. But I think that is the right approach. You have to find a better or healthier alternative, right? I think Amol has a question. Amol.
Good afternoon, ma'am. Good evening, ma'am. And good evening, sir. So
Hi.
actually, I had a question
Mhm.
that, sir, as a non-professional, what can you do to your friend, to help your friend regarding these issues, mental issues, ma'am? Because I feel like even in my friend circle, ma'am, sometimes they come to me, and sometimes they consult themselves also. Okay, I'll take care of myself. But when they can't, they come to me, and I'm in that place then that I have to guide them through something, or they will go wrong, ma'am. So as a non-professional, ma'am, what can I do to help them better?
Okay. Thank you for that question, Amol. I think there are a couple of things that we can do as caregivers. And there are a couple of things that I think we must not do as caregivers. I think I'll talk about both. So I'll start with what we must not do. I think the first thing is that, of course, dismissing the emotions, what they're coming in. And that's something that we might feel that we don't do it, but it's actually very common. A lot of times we invalidate it, saying that, you're just making a big deal out of it, big deal. Why are you feeling so sad about this small little thing? And which obviously we are saying it out of genuine, concern, because we feel that it's too big a reaction to a particular thing. But that's the thing, like each of one of us are different, and how we perceive a particular event is also very, very different. So while I might not, like, even when it comes to movies, there are some of us who really enjoy horror movies, and while there are some of us who just can't take it, can't deal with it, right? So it's the same thing, it's same movie, but two different reactions when, with two different persons watching it. So same thing with events also. So I think the best thing we can do, the last thing that we must do actually, is to invalidate that emotion, because if that person is feeling it, they are feeling it. And just by us telling us that, you shouldn't feel this way, is not going to help them to not feel it, because emotions are not directly in our control. We don't have a switch on or off button that we can just, put it off, right? So I think that is like a no. Second thing is, a lot of times we have a tendency to start talking about our own problem relating to that. So when they are telling you about this one time when, or let's say they had a fight with their girlfriend, and it just reminds us about the time that when I had a fight with my partner, and I start talking about that. But that's also something that invalidates that, because that person is coming with their focal issue at hand, and when we switch it and we make our problem a focus, that can also invalidate it, to some extent. So I think these two things are primarily that we mustn't do. What we can do is, of course, be a better listener, just listen and hear them out. And second is, because it's a friend, or somebody who's, who we care about, we might want to jump into solving that problem for them, right? I think just the concern that you spoke, because internally you want to help them out, they are in a problem. So the first instinct is, okay, you can do this, you can do that, so we just can start coming up with solutions. But more often than not, they might not be looking at that at all. They might be just looking at someone, to just hear them out. So just helping, I think the best way to help a person is just by listening to them without any judgment and without providing solutions. And as a non-professional, that is the best thing that you can do for any person. because chances are that they might even know the solutions, but they just want a friend right now to hear them out. So yeah, I think that's my answer for you. And just another thing that I want to add, that any point of time when you feel that it's a lot, it starts to affect you, because again, you are a person too, and you're not qualified enough to deal with a lot of overwhelming things a person talks about. So then the best thing is to do is to tell very politely that, I really want to help and I want to be here for you, but I think it would be better if you take professional help for it, and I can maybe figure out with you, who you can go for help to. But I think me helping you might not be the best thing at this point of time.
I agree. And one more thing I had that, ma'am, when a person is in that phase, it's like if you want to get into their comfort space, we have to agree to their things when we don't even want to. Like if they are sad and they say like, "Oh, the world is so bad," and if you want to enter their space to like, "Okay, we'll rejuvenate you, we'll like give you some fresh air," we have to agree to that. Yeah, the world is so bad, and then we have to go inside and then change our thoughts. Ma'am, so I want to like have a way or something where we can put our thoughts into it while disagreeing with them also, because it's not right that we are agreeing to the wrong things.
Yeah, I look at it, in terms of that's how we empathize with a person, right? By getting to the feel of what they are feeling. So now, if we are putting our own thoughts or beliefs onto it, then it becomes like a judgment. That then it's almost like we are judging them for what they are feeling and thinking, because I think differently and I feel differently about it. So when at that moment it might not be the best time, but once they have calmed down, once you have heard what they have to say and they have let out all their feelings and emotions, then of course you can be genuine and you can tell them what you genuinely think. That, without invalidating and judging what they are thinking, just letting them know that, okay, while you are going through this, that's fine, but here's what I think about it.
Thank you. Thank you, Charvi. Thank you, Amol, for your questions. Amol always comes up with really interesting questions. The second one, yeah, dil jeet liya tune. Maza hi aa gaya, honestly. Okay. Does anyone else have any questions, or I have one I can ask? Okay, so there are a couple in the chat box. Couple of questions. I'll go with the first one. So there's someone who is going through mental health condition, and he is taking professional help as well. He's on medications. He wants to get off medication. So what should he do to improve his mental health and, and get off the medication soon? What would be your tips on that?
Okay. I think, yeah, I think as clients, or as person who is seeking mental health help, I think it is important that we are given a choice to decide for ourselves whether we want to opt for medication or not. But at the same time, there should be an informed decision. So I am not sure what you are going through. So I'm just going to talk in very general terms. So when it comes to there are two areas which I feel that medication can really help with. Otherwise, it becomes a struggle to really deal with it on your own. I'm not saying that you can't, but it's just that with the help of medication, it just becomes so much more easier. So the questions that, to figure out and to decide for yourself whether medicines are right for you or not is to figure out that, one is, are medicines, if you're already having medicines, which you are, I heard, then why do you want to move off medication? Is it because the medications are causing a problem to your functionality? Because sometimes, yes, medicines can make you drowsier. It can help make you feel a little numb sometimes. So is it because of that, or is it because of the shame attached to psychiatric medication? Because if it's really coming from shame or log kya kahenge, then clearly that's not the reason why you should stop your medication. Uh, but if you feel that you're doing just fine, and you've sort of been better in your mental health space, and I think it'd be nice to sort of converse with your psychiatrist and with your therapist to see if they are on the same page or not. And once it's like a team approach, right? Once they are also on board, and if you are on board, then I'm sure with team effort, you can reach to a level where you don't have to deal with medications anymore. So yeah, like I said, when it comes to if you have a condition which has a little bit of psychosis, then medication becomes important. And secondly, if you have a condition wherein insight is not that high, your ability or your insight becomes diluted sometimes. I think those two are the areas when medicines becomes very important. But if these two are not there, then essentially you can go off medication at any point of time.
I think shame attached to medication.
I'm just going to add a disclaimer here that do not stop medication on your own. It's very important that you talk to your psychiatrist, and because there is a way to stop medication, so please don't ever do that on your own.
Awesome. Thank you. Okay. I hope जिन्होंने भी ये सवाल पूछा था उनको ये जवाब मिल गया है. But so before I go back to the chat, I have another basic question. Charvi, I want to know, or I want you to tell everyone, if possible, what actually goes in a therapy session. Therapy session में होता क्या है? Because not a lot of people know. जिन्होंने experience ही नहीं किया है. So can you just brief us like what exactly happens and what is that journey like of being with or working with a therapist?
Well, okay. So therapy, I think there are a lot of myths around therapy as well. And I think it'll be nice time to sort of clarify all that too. So one is a lot of people think that going to therapy is like going to somebody for advice. It's like they feel that they'll go to a person, they'll ask, what should I do? And that person will just give you this, okay, you must do this and you must do that. And that's actually a very big myth that, it's very rampant actually, this particular myth. And I think I want to clarify that no, therapy is not about advice giving. So as a therapist, I do not, I will not think, I don't think I'm in a position to tell you what to do or what not to do. Yes, what I can help you with is to clear out certain thoughts. If you have a confusion, I can help you organize your thoughts for you. I can give you insights upon some things that you have shared with me based on the psychological knowledge that I have. But at the end of the day, what you should do or what you shouldn't do, that's not something that I am going to be telling you, because we believe that you are the best person to know that, because you are living your life. And no matter how trained I might be, but I will still not know what the best possible path is, or what the best possible road is for you. So that's something that we don't do. If you are seeking a professional who is giving you advice, then that's probably not the right kind of professional for you. Then you might want to change, because that's not something that we do. Second, I think myths that people have is therapy is for people who are going through some sort of mental health condition, or an ailment or a psychopathology. And again, that's something that I cleared in the beginning also, and I'm again clearing that therapy is for everyone. You don't have to have a problem very big enough, or something that you have a trauma, or you have you're struggling with something to really go for therapy. You can, just like we work out, we go to a gym, we have a trainer, even when we are not going through something major, because we just want to be better. We want to be the best version of ourselves, physically. Therapy is same. It's just very similar to that. If you want to be the best version of yourself, if you want to be that confident individual, therapy is for you. Because in today's day, I think I don't think there is any of us who are not dealing with day-to-day challenges, or who doesn't have stress, whether it comes to career-related relationships, because there are challenges in every aspects of our life, right? So just a little support from someone who is trained, it just helps us to sort of have that guideline in how to really help our own selves. So these are myths relating to therapy, and what really happens in therapy session is very basic. It's like a conversation you're having with another person, very similar to the conversation that you have with your closest friends. Only difference is that you are speaking not to a friend here, you're speaking to a trained qualified professional. So they have been trained to hold this space for you, which without providing judgments, keeping it completely confidential, and giving you just the right kind of probe so that you can know yourself better.
Okay. And does it have to have like, can someone do with one session, or does it have to be a package or a few sessions, or how does it work?
It's very flexible, actually. You can even have one session if it's something very small decision making that you have to do, or some confusion that you have, and if maybe it can happen in one session also. But usually, typically, because therapy involves going deeper, talking about what's going on a deeper level, because we look at the roots of certain problems and issues, then typically it does take longer. So it would take longer depending upon what is it that you are coming with, what is it that you want to work upon. And a lot of times, clients come to me when they want to work upon this particular area, and then they realize that, oh, I want to work on this as well, on that as well. So then it can continue for longer, because now you want to work on other facets as well. There are clients who come to me with one problem, and when that gets sorted, they take a break, and then they realize that, okay, there's another thing that they would want help for, and then they come back to me later. So it can be anything, however it suits you, whatever your presenting issues are, or whether you want to go back and work on some past areas as well. So it's very, very flexible. It's up to you what you want to work upon and how many sessions you want to do. It's a collaborative decision.
Awesome. Okay. Wow, there are so many questions. There are so many questions in the chat box. How are we all feeling, by the way? Are we enjoying the session? Can we show some love to Charvi in the chat box, or just in the emoji forms? I'm completely okay with either. But thank you, Charvi. I'm really enjoying this conversation. And you bring so much of stillness to the conversation. Like, people who attend my workshops, they know this has never been this still. यहाँ पे इतना formal discussion चल रहा है. It's very, very still, and I'm loving it. Thank you, Charvi. So let's get to the next one. So there are some personal questions here as well. So people are explaining their personal issues, and so it's entirely up to you if you want to take those personal questions here, or you can just give us a general idea around that issue. So one of them is, I'm suffering from breakup issues since last 6 months, not able to concentrate on my work, and I want to get rid of it. What would you tell?
Yeah, so I think it's difficult to say something in 2 minutes because it's a lot that you're obviously going through. And when it comes to breakups, it does cause a toll to our, every aspects of our life, because when we are with a person and if it's serious, obviously there's a lot that we plan in our head with that person. And suddenly when it sort of comes to a halt, or when a breakup happens, all of those plans in our head, all of those memories, it just can make our world upside down. So so of course, breakups are not easy. It's very, very hard, and it's a long process to sort of let go of what you're going through. I think what can help, is a very cliche thing that I'm going to tell you, which is closure. So that closure could be a conversation with that person, or it could be how you're perceiving this entire thing also. So sometimes it can be just closure that we can give to our own self. So, but obviously it's not a generic answer that I can give right now. I think I would really suggest, if you can see somebody about it, I think it would be really nice. I mean, it would be a really helpful thing to sort of right now, the current situation that you're into, to have some sort of support for yourself.
Okay, there is one more. It's along again the personal lines. One of my family members had a mild stroke a couple of years back. A year back, she developed OCD, like washing hands and basically anything related to contamination. This is for now not bothering her much, but can we help her to fight it naturally without medication?
Yes, absolutely. I think OCD, or the obsessions and the compulsions that a person has, it can be dealt with without medication. Because I'll tell you how it works. All right. So essentially, what does medication do? It helps with your symptoms. And what in therapy, what we actually do is we try and get to the roots of why it's happening in the first place. So OCD is usually, how we look at OCD is from the lens of anxiety. When anxiety becomes too overwhelming, it manifests itself physiologically also, and it can manifest itself in various other ways. So it can manifest itself as panic attacks. I'm sure you might have heard of this term, panic attacks. It can manifest itself in phobias. A lot of people get different phobias. So that's anxiety too. It can manifest itself in the form of intrusive thoughts, a lot of negative, unwanted thoughts, and it can manifest itself as OCD also. So essentially, what we are looking at is anxiety, and anxiety is so basic that we all know what it is. So since it's that basic, it can actually be dealt with also from a very basic lens. So yes, so I think find the right therapist, and if your anxiety is taken care of, I'm pretty sure the OCD symptoms will also start reducing.
Right. Okay. Next. Okay. How to deal with toxic and manipulative people at workplace? Despite working hard and burning midnight oil, they keep demotivating, and it loses out my confidence. I have been through a lot of burnout since lockdown. This has been affecting me a lot. Is this just a phase due to work from home or a mental health issue?
Okay. Yeah. So people at work impacting you, right? Yeah. So while I think, there are certain things which are not in our control, like how people behave with us is not something we can do much about. But, how we perceive that, that is definitely something that can be helped. That is something which is in your control. So there are two ways that I would go about it. Firstly, a lot of times our reaction to things also also sort of calls upon a certain behavior from another person. So for example, if we are not standing up to our own selves, if we are not being assertive around, then a lot of times people can take us for granted. So I think it'll be important to just check your pattern of how you're dealing with people at work. Are you allowing them to walk over you, or how are you dealing with when they are not being respectful towards you? I think that is a key element to look out for. And in case you notice that the way you are dealing with it is from a passive lens, then it might help to be more assertive. And secondly, then looking at our own selves, how we are perceiving this entire thing. Like you said, I think that your confidence level is now taking a toll. So it sounds like you are internalizing this entire thing also, right? So as long as it's external, it's somebody else, then we don't get affected by it. But if it's affecting you, that means you are believing them to some respect, and you are also judging yourself in some aspect. So I think it becomes important to sort of reflect upon that. Why is that those people's reactions are impacting you so much? Do you believe them? Do you believe that it's personal? Are you taking it personally for that matter? If yes, then that is where we need to work upon.
That's really interesting. And I'm loving it that I work along the same line. So that's what I knew about dealing with interpersonal relationships. So that validates what my practice is like. Okay, so there's another one by Shivani. I think she's talking about Disha. I'll come to you in a minute. Yeah. Actually, yeah. So it's a quick one. The fear of taking medicines is like they might become addictive, or you might need a higher dose to get the effect.
Mm-hmm.
Do they also come with side effects? So how much of it is truth?
Yeah, I think all of that could be true, but I think same is the case for medicines that we take for physical ailments also, right? So if we have hypertension problem, blood pressure problem, we do have to take medicines on an everyday basis. If we have diabetes, we might have to take insulin on an everyday basis, and which might mean that we might get addicted to that medicine. But we need to do that, right? So similarly, if for mental health problem also, if you can't, if you're finding it very difficult to go by without medication, if it's too much of a struggle to keep a check on your mental health on a day-to-day basis, then it's not wrong to take the help of medication. But if you feel that that this is something that I can deal with, and if I have the right tools and the right skills, I will be able to overcome this, then of course you can have a chat with your psychiatrist. You can figure out a way to reduce the dosage, and then to make do without it completely also.
Yep. I love it. When we, draw parallels between physical and mental health, now it's easier for people to understand. And, when you were explaining about how we are completely okay with physical ailments, in fact, we romanticize them, So if you see two 50, 60-year-olds talking about it, मेरे को तो diabetes and like मेरा sugar 400 जाता है, and like मेरा इतना जाता है. So they romanticize the whole thing. But in the same way, अगर बच्चे ने बोला कि पापा मेरे को anxiety, I need to see a therapist, done है. ऐसा वैसा कुछ नहीं होता. पढ़ाई पे ध्यान दो. पूरा दिन मोबाइल पे रहोगे तो क्या होगा?
That's so true. So true. And believe it or not, this is not just something that generally we tend to do, but even the most educated of people. Like I've had workshops in schools of like really reputed schools, and we've got this response from the teachers that that they don't believe that stress and anxiety is real. They believe that it's just something that we talk about, like to like an excuse to just get away with certain things. And I think there's so much of gap, when it comes to the awareness relating to mental health. And I think that's exactly what we need to do more. Like we need to have more of these conversations. So I'm so thankful to you, Umesh, that you chose this topic to talk about today, and it's so important to be addressed.
Pleasure, yeah. I'm really, this is something which I'm really passionate about too. So lucky to have you and have a like-minded person, साथ में. तो मजा भी आएगा. Okay, so there is another one. There is a personal one, but उससे पहले Disha, where are you? You had a question.
Hi, Dr. Umesh. Hi, Dr. Javi. I had a question. Suppose in a family, one of the parents has severe mental health illness, and it is affecting the parent's relationship with its child. And the person is in denial, and he has not identified his his or her issues. How do we deal with that? And it is absolutely clear to the rest of the family members that the child is having a traumatic childhood because of that issue. But the parent is in denial, or has not identified the issue itself. So how do we deal with that?
Okay. So are you talking about, how to help the child or how to help the parent?
More about the child, because it's happening in my family, and my brother is affected. He's been having suicidal thoughts and everything, and it's getting worse day by day. So I really want to know, how do I do something to make everything a little better for him, because my mother is in denial. We have talked to her. It's been happening since the last 7 to 8 years, and she's not मतलब होता है ना कि मतलब एक एजुकेशन, लैक ऑफ एजुकेशन की वजह से शी डज नॉट नो द इम्पोर्टेंस. तो उसकी वजह से अब ये बहुत डीप रूटेड इशू हो जाता है. तो फिर अगर हम लोग उसको अभी छेड़ने जाएंगे तो इट्स मोर ऑफ मतलब पूरा सिचुएशन ही फिर डिफरेंट हो जाएगा. बट आई नीड टू हेल्प माई ब्रदर बिकॉज ही इज जस्ट 15 years old. And so yeah.
Wow, that's a lot to deal with. Disha, is Disha's your name?
Yes.
Okay, that's a lot to deal with, Disha, and I'm sorry that you're going through so much, and there's so much going on in the family. And it's so nice of you to be concerned about your brother, and you are right. When it comes to any person in the family, even if it's like one person, if they are going through something, it impacts the entire family.
Especially when it's the mother, when it's the homemaker.
I'm sure. Yeah, absolutely. And why it might be impacting your brother so much is because when it comes to family, the boundaries don't exist so much, especially in the Indian scenario. We don't have the right boundaries within the family, right? There is a lot of enmeshment, there's over attachment in the family. And that's when, we almost look at our parents as an extended version of us. So if they are dealing with something, or if they happen to tell us something, it becomes like, it really internalizes. And that's when, if our parents are critical, or if our parents are going through something, it can really impact our self-esteem, impact us, in future as well. So
Absolutely.
yeah, I think I would really recommend you, seeking help for your brother in the form of having him talk to a therapist, because even though you may not be able to do much about your mom, he can still strengthen his resilience, and he can still figure out ways and tools, so that what's happening externally, or what's happening in the family, it doesn't impact him the way it's impacting him right now. So there are ways to do that.
So,
That's what I'm trying to say.
how do I convince my father, because he's the head of the family right now? So, how do I convince him? Uh, s-
Um, Well, if you want, we could speak to your father also. Like, as professional, we can speak to your father if that's the way you want to go about. Or you can just tell your father that your brother wants to talk to somebody. Like, it doesn't have to be a mental health professional, but he's talking to someone for counseling. And I think counseling is a term that people take to very easily, especially parents, when it comes to their child, because they feel like, okay, my child is going to, is going to get guidance, is going to get fixed. So they take to this term better than, a therapist, like the elder generation. So maybe bringing it from that point of view, that maybe, he wants to speak to somebody, he wants to speak to a counselor because he's going through something, I think. And if that works, then okay. If not, you can get in touch with us, and we can speak to your father and tell them exactly what our approach is and get him on board.
Thank you so much.
Awesome. Thank you, Disha. I think it is a very important question. A lot, not many are talking about it, but this is very, very important. हम बहुत सारे लोगों के families में similar issues are there, and I think that answer was for a lot of us. So thank you, Charvi, and thank you, Disha, for asking this question. Yeah. Wow, that was intense as well. And Disha, I'm really sorry to hear that as well. Okay, you and your brother has to go through it. Okay,
Thank
next
you
one.
for conducting this session.
Pleasure. Okay, we have बहुत ऊपर तक चला गया है, so just I just want to go into chronological order so no one feels कि मैं भूल गया किसी का सवाल. Okay, who needs counseling, or how can we understand when we need to speak to a counselor? I think we already have covered that. If we are not, yeah. So Dhwani, I'll send you the recording. I think we have covered that. Yeah, if you don't want to take medicines and go for only therapy, will that help a OCD person? We have covered that. Is it good from physiological perspective to isolate ourselves from society to achieve our goals and working efficiently?
Okay. Wow. Well, that's a very difficult task to, put ourselves into, because essentially we are social people. Even the most introverted people, they also need that human connection. So yeah, so as long as you're not doing it in extreme, you're allowing yourself to have breaks and to have some social connections, then I think it's okay. I think the key is, balance. If you're able to balance it and not doing it in extreme, then it's all right. Also depends a lot upon the kind of person that you are. Some of us need more social interactions. Some of us are okay with limited. So just check with yourself, who you are, if you are okay with doing this. But obviously, doing it on an extreme way, isolating completely, is definitely not something that anybody would recommend. And I think COVID-19 is the best example. Look what it did to us. Even the most sane of us, became insane in these few months when we were in lockdown. So yeah, please don't do that to yourself.
I think that comes from that space as well, कि हम 6 महीने के लिए दूर चले जाएंगे and we will transform and show the world कि what we are made of. And that this interestingly enough, this question came from my Bhatija. So Bhatija, we need to talk. What's up?
He
Okay.
probably wants to get rid of you, Umesh.
Sorry?
He probably means he wants to isolate from people.
I know. But he doesn't live with me. That's another thing.
Okay.
मैं इतना परेशान नहीं करता. Okay, but I'll speak with him. All right. So there are other questions, but before I come to the questions in chat, we had some questions in advance. There are a couple of questions. So one of them, which I remember, actually दोनों same person से आए हुए हैं. So I'll ask you both the questions. I don't know how you're gonna articulate them together. The first one was how important is it for a therapist to share some personal things with the client to create that personal bond with the client? I'm not sure where this question is coming from or what is the context behind it. That's one. And two, why is it important to have boundaries? These are the two questions that I received.
Firstly, very interesting questions. So to tackle the first one, which is how important is it to have personal disclosure, like from a therapist point of view? So yeah, I think personally speaking, in my practice, I think it's a great tool to use. Sometimes when I do talk about my own personal examples, to put forward a point or to explain what I'm really talking about. It does really help a lot, because one is that example is coming from directly from the first person's point of view, right? I'm not talking about some hypothetical thing or some random example. I'm talking about a genuine one-on-one example, so obviously it has a better impact. Secondly, it helps in building the rapport a little bit more, because that person knows me more, and now that person can trust me because I'm also showing that vulnerable side. But at the same time, I think it needs to be done with a disclaimer, because oversharing is obviously not good, because the therapy is about the other person now. It shouldn't, the focus element again shouldn't become me, that I am just talking about my issues and, overpowering what the client is talking about. But if it's relevant, if it's something that is, that can make the point of what you're trying to say, then of course, why not? It's a great tool. Now coming to the second question, yeah, but I would love to know what the context of that question was. If you are watching me, then if you don't mind, would love to hear where this question came from, or why this question popped in your head in the first place. About boundaries, is it the question is that why do we need boundaries?
Why do we need boundaries? Yeah.
Okay, so let's take this example. Okay. Like in a family system, we are taking in the context of family system. Let's say that there was no family boundary. Okay, so right now what happens is that, okay, you have your mom, you have your dad, and you are there, and maybe you have a sibling. So then we consider, okay, this is like a family. Some people have maybe a more extended family. They have their uncles also, and maybe they have their dog, or you know what I mean. But let's say that there is no family system. Okay, there is no boundary here. And now, if you want to come to a decision, let's say about your future, about your career, or you need to do something done, you need to get something done, who do you seek permission from? If there is no boundary, then the neighbor also has the right to come and tell you that, okay, you should do this and you should do that. Or some stranger person can also come and tell you. This example might seem a little off, because that's exactly, I'm talking in the form of family boundary over here. And now when we use this boundary to talk about the self, whether self boundary is required or not. But it's the same thing. Like if we don't have individual boundary, then how do we know who we are and where do we draw that line? Then we allow people to sort of walk over us. Sometimes we allow to, let people take advantage of us. So there are, so many cons of not having a boundary. And I was trying to explain it from a family lens. Similarly, like, if you have very stringent boundary also, that is also not a great thing to have. So, for example, if a family has a very stringent boundary, they look down upon the family members interacting with other people, and everything that they want to do is together. Like if they have to party, they will do only like the family has to party, or they have to go for a movie together. And they are looked down upon the friends, maybe the friends going, for an outing, and so on and so forth. Then obviously you are limiting the exposure, you're limiting your growth, your personal growth. So both ways, it's important to have boundary, but it's also important to have the balance of that boundary. Like you can't be too into yourself. Then there won't be scope for growth and external perspective. I hope that made sense.
It did. It did. It certainly did. Wow. So boundaries, they define you. Hmm. In a way, no? If you don't have any boundaries, you don't know who you are.
Doesn't it? Then
Hmm.
you don't have principles, you don't have values, because it will change with the kind of people who you are with.
So people who don't have any boundaries, do you think they need help?
Of course.
Hmm. Okay. All right. So I think we are done with our 1 hour. Now, I want to ask first of all you if you are open for a couple of more questions. If you are okay, then we can go ahead. And then I want to know from others as well if they are okay staying for a couple of more questions. So, what should we do?
Well, as for me, I don't mind at all. I'm really enjoying this interaction. So bring it on.
Awesome. So, जो लोग को जाना है वो हमें गुड बाय बोल के जाएंगे चैट बॉक्स में प्लीज. All right. So, we will go for let's go for a couple of more questions. But before we go to those two questions, as I was telling you at the beginning of the session, जो चारवी अभी तक हमने उनको ऐड नहीं किया था ग्रुप में, she runs this really unique therapy center. उसका नाम ही इतना यूनिक है, ओवर अ कप ऑफ कॉफी नहीं, ओवर अ कप ऑफ टी. मैं कल गलती किया था, आज मैं वापस से सुधार रहा हूँ खुद को. It was over a cup of tea. What you can do is hit her up on Instagram पहले तो, ठीक है? And I'm putting her Insta ID in the chat. तो जैसे ही तुम लोग हिट कर लो मुझे बताओ, उसके बाद हम मीटिंग आगे बढ़ाते हैं. फिर उसके बाद तुम भूल जाओगे.
That's so sweet, Umesh. Thank you for doing that.
No, it's because Chavi, as I was telling you on the phone, हमारी पहली मीटिंग में भी बताया था, I get so many questions around a reliable source of therapy. हम किसको अप्रोच करें? Why is it so expensive and stuff? ये सारी चीजों का जवाब इनका वेबसाइट है. Just go on there. It's so affordable, and the main reason why I wanted to do this session was because I wanted everyone to see you and how calm your personality is. I think if I needed some help, I would love to come and sit and talk to you. It's you are very approachable, and I wanted everyone to come and feel that. You know? So do check out her page, do check out her website, and yeah, see if you guys can get some help from her. Awesome. So
I just want to add here that we are available online. So no matter which part of the country you are in or beyond, you can still reach out to us.
awesome. Thank you. Okay, so Upasana, I think there was one question. Did it? I'm coming. Two questions. Yeah, two questions we are taking, and then we'll go. But जाने से पहले हमारा selfie भी होगा. So whether there are good comments right here. So Malka is saying you are superb, Chavi. Dhwani is saying okay. कहाँ गया? Very important. So how can I deal with my clients when they have some personal issues and they directly say आज mood नहीं है workout करने का? Coming from personal trainer.
Oh, okay.
How do we go about that?
Well, I don't know. Is this a psychological question? I am not sure. I mean, I'm actually out of words about this. What do you do अगर आज mood नहीं है तो? So I think a little bit of motivation goes a long way. So while of course if mood nahi hai, to you don't have to do the entire workout. But I think what can be done is maybe just letting them know that, okay, let's not go the entire thing today. Maybe let's do half of it if that's all right with you. And maybe once that person starts doing that half of it, maybe they might be on board to do the rest of it also, because a lot of times just starting it off is something that we get lazy about. So I don't know, maybe I could go about that. I really don't know what else.
No, but that's 100% from my personal experience of 8-9 years. That works. That 100% works. So if a client comes down to you not feeling like working out, उनको बोलो जिम वैसे ही आ गए हो तो might as well थोड़ा शुरू करते हैं. Action leads to motivation. Always. तुम कितनी भी बातें करने बैठोगे ना शुरुआत में तो it won't work. Just उनको शुरुआत करा दो. It should be fine. Upasana is like my brother passed away 8 years ago. My confidence level is very low. I'm 28 years old. My marriage is not done. My mother was always crying. What can I do? My mental condition not well. Please help me. Now, I think this is again very personal question, but would there be any specific tips that you would?
I think I wouldn't like to give specific tips because there's so much more to you that you're going through, and it'll be unfair to just give you something, in these 2 sentences that you've mentioned. I'm sure there's so much more to your story. So I would really recommend that you see someone, to talk to someone about it. It's so important to get professional help sometimes.
Yes, I think that would be the ideal answer, because it's really short time and it's not the right space as well to discuss personal issues right here. Okay, there are a few more questions as well, but I think we will keep it for some other session. Nothing major. एक ले लेते हैं last. Interesting. Sometimes you don't feel like doing anything, and the worst thing that is you don't know the reason. You don't want to even smile. Is it depression? But also I get better in a few hours or a day.
Yeah. Okay. So will it change? Whether it's depression or not. How is that relevant to what you're going through? Like, let's say it is, and let's say it's not, but you're still going through this off and on, right? So whether that label is there or not, I would still recommend that you explore why this is happening to you with the help of a professional. If it's not depression, great. You could still figure out and learn certain skills, on how to deal with it if it happens, so that it doesn't impact you, if it doesn't stretch for too long. And if it is depression, then obviously it will have to be dealt with in a more serious way. So either way, I would say figure it out, explore it with the help of a professional.
Awesome. Amol, you want to say something? Go on.
Thank you, sir, for pushing some boundaries for me. Actually, one more question I had that. The first question is related to like a friend of mine. She is maybe suffering from depression, and in her life, she is like not excited at all. She doesn't have any excitement left in her life right now. She feels lonely a lot, and also that wherever she goes, she just want to come back home and go to bed right away. She don't want to have some human interaction at all, and this like stuff is going on. And as a friend, I feel like I feel bad for her that she was not like that. Yeah, she was like so much having fun and everything. So what to do, mom? I don't know what should I do. Like, what can be an answer for her? Just that. Thank you.
Yeah, again, Amol, I think it's really nice that you have noticed this about your friend, and you genuinely are concerned about this friend. So I think you can maybe just checking on this person. A lot of times we can assume that something is off, but maybe it's not. So just directly, rather than beating around the bush, just directly asking that, how are you doing? I've noticed that, I've observed that this is what is happening. Earlier you used to be this person, and now you seem to be a little more reserved. is there something that's going on? Would you like to talk about anything? I'm here for you, just letting you know that I'm here if you want to talk about anything. So just leaving that message so that this person knows that, okay, they can reach out to you in case they want to share, in case they want to confide in somebody. And once they do confide in you and you do understand that this person is going through something, then maybe you could suggest them to seek professional help.
But someone is asking, wouldn't that make them go in a shell?
Oh, wouldn't that make them go to a shell? Well, if we ask them from a judgment point of view that what's wrong with you, why are you not doing this, so there's why questions can, of course, it can make a person defensive and make them go in shell. But a general check-in that, okay, how you doing, and I noticed that you're not maybe talking so much, or you're not being your general self. Just wanted to know how you're doing. I don't think that can make anybody go into a shell. I think that can just be very inviting, even though it doesn't guarantee that this person will open up to you or will share with you. But at least now that person knows that somebody has noticed, and that it is something, if they are in denial, they will know that, okay, it is not something that I'm feeling it anymore. People are noticing it. And it will also give a message that you care. And in case he or she wants to reach out to somebody, you are a person that they can reach out to.
We have to shoot off now. अगले बाकी के जितने भी सवाल है उनके लिए हम वापस से एक और सेशन करेंगे. Not a problem. Let's start your cameras and let's come and let's do a selfie. And okay, hope you guys had good time, and you do let Charvi know when I'll share the screenshot with you all, है ना? तो वो स्क्रीनशॉट अपने सोशल मीडिया पे जाएगा, फिर चार्वी को तुम टैग करोगे और उनको बताओगे कि कैसा लगा. सिंपल प्रोसेस है. ऑलराइट, लेट्स डू दिस. ओके,
थैंक यू फॉर द अमेजिंग सेशन.
pleasure. Alright, on a count of 3 and 2 and 1. Awesome. एक और स्क्रीन है हमारे पास. All right, and 1 and 2 and 3 and let's go. Great. Okay. Yeah. Charvi, any final words for everyone?
I just have to say it was a very, very interesting session for me. I love the questions, and I'm just hoping that we have more of these conversations, not just in these live sessions, but even personally in our own circles. Please talk about what you're going through. It's so important that we talk about our mental health issues without any shame and without any stigma. So that's all.
Great. So before we go, thank you so much, Charvi. Thank you so much for agreeing to do this. हमारे वीकेंड जो वर्कशॉप्स होते हैं उस पे आपने 4 चांद लगा दिया. ऑनेस्टली आई एंजॉय इट. पहली बार मुझे चुप और शांत रह के मुझे अच्छा लगा. So thank you so much for doing it. And thank you everyone for joining in. मिलते हैं अगले वीकेंड वापस से.